My name is Dr. Edward Rosick. As we can see up there, I'm the Chairman and Medical Director at Michigan State University Family Community Medicine Department. I've been asked to talk on complementary and integrative medicine for the geriatric patient. I just want to let everybody know this talk is sponsored by a HRSA grant. So we'll take it from there. I know everybody's hungry. It's been a long day for everybody, so I'll try to roll through this. I'm not going to rush through it, but we'll try to get through it. If you have any questions, I love to answer questions. If you could wait till afterward, if everybody wants to go to dinner, I'm happy to stay as long as anybody wants to talk about this stuff, because there's a lot to talk about. So let's get started. So first question I'll often get from both patients and physicians, what's complementary and integrative medicine? I like to use that term versus alternative medicine. Why? I don't know. I just do, so I use it. It's my talk. But really, what complementary and integrative medicine is modalities that are not commonly used in modern or Western medicine. Things like the use of supplements, things like vitamins, herbs, minerals, prayer, relaxation techniques. And in half jest, at least, things we weren't taught in medical school. It's getting better. Certainly, many medical schools are incorporating complementary and integrative medicine therapies or concepts into their curriculum, but it's at a snail's pace. And so a lot of the things I'll be talking about, our students never get to hear, unfortunately, in my opinion. Of course, it's always worth remembering that what's integrative, complementary, or alternative today will be mainstream tomorrow, right? Things like osteopathic medicine. 50 years ago, we were all thought of as quacks. We're now accepted. Granted, there are still a few people that think of us as quacks, but by and large, we've been accepted, grudgingly or not, into the mainstream medical community. Acupuncture, biofeedback, again, 40, 50 years ago, were thought of as quackery, and now they have been accepted, by and large, into the mainstream medical community. So again, what I'm talking about today, perhaps tomorrow, 5 years, 10 years, will be thought of as mainstream. So why should we care about it? Why should I be giving this talk? Why should I be taking up your time and my time? Well, one of the reasons is our patients are using complementary and integrative medicine. A recent study a couple months ago in the Journal of the American College of Nutrition reported that around 50% of Americans take supplements. Those in the female gender, those in the geriatric population, at least 50 or older, are the highest users. Our patients are using it, whether they're telling us or not. They're using alternative or complementary and integrative therapy. If you look at patients in certain categories, in this case patients with cancer, up to 70% of patients with cancer are using integrative therapy. So again, they're using it. We need to know about it as physicians. Most patients who use complementary and integrative medicine use multiple therapies, vitamins and minerals, relaxation, meditation, yoga. So why do patients, especially geriatric patients who are the highest users of complementary and integrative medicine, use this stuff? Well, for prevention and treatment of chronic diseases. I will state that I think we in Western medicine, we in modern medicine, do a great job at treating acute illnesses. We do a great job at treating infections. We do a great job of treating trauma, right? If, unfortunately, when I'm driving home tonight and I get into a multi-car accident on the lodge, I don't want somebody waving a crystal over me. I want them dropping the latest helicopter down, picking me up, and taking me over to the Detroit Medical Center, and having a trauma team ready to save my life, okay? We're great at that. We are not great. I will say we're not even good at preventing a lot of chronic diseases, which is what kills us today, right? We're not dying, by and large, of infectious disease. We're dying of chronic diseases, cancer, Alzheimer's, heart disease, type 2 diabetes, right? None of us see that in our practice. So that's why patients are using this. They want to prevent these diseases, and we, by and large, can't do a lot for them. As adjunctive therapies to conventional treatment and the rising costs of prescription drugs, along with the idea that natural is better, right? Hey, if it's natural, it's more healthy, it can't hurt you. which of course is a total falsehood. The most poisonous substances known to man are natural substances. But it's a common misconception. From having done this for a couple decades now and talking to many thousands of patients, I believe patients use supplements, integrative therapies, because they want to enhance their sense of control. When they come to see us, they lose their sense of control. It's a natural order of things, of course, but they still want that sense of control. They can do this by taking supplements, by using alternative therapies. So please keep that in mind. They're not doing it to thumb their noses at us. They're not doing it because they're not smart or because they're stupid. They're doing it because they want a sense of control, which we all want. We all want the sense of control over our lives, over our health. So what, you might be thinking? We got a lot of other things to worry about, right? Our last speaker, Dr. Mustonen, giving us all these acronyms, HIPAA and all that other stuff, EMR. My God, our time is being sucked up by a black hole of bureaucracy. Just mine as much as anybody else's. Why should we care about one more thing? Why should we care about complementary and integrative medicine? What do I care if somebody's taking fish oil or horse chestnut or whatever the supplement du jour is? Well, a lot of us don't. Recent study shows us that 20% of physicians dismiss complementary and integrative medicine out of hand, meaning it doesn't work, don't worry about it. 33% report they don't know enough about supplements to say anything either way. So either over half of us don't care, don't give a damn, or both. Well, we need to care, we need to give a damn. For multiple reasons. Why? Well, supplements can do a lot of things. Remember, natural isn't harmless. Natural can cause a lot of problems. Natural can cause death if done incorrectly. Side effects, symptoms, outcome measurements that we might think are being caused or driven by our wonderful pharmaceutical medicine could be driven or caused by supplements that patients are taking. We need to know about it. This can lead to changes in therapy, expensive tests, or more serious consequences like death. We need to at least know if patients are taking supplements. Every time a patient comes into our office at Michigan State, we ask them, what medications are you taking, what prescription medications are you taking, what supplements you're taking. We need to know it. I personally ask all my patients because, of course, since I'm into integrative medicine, I have a lot of patients taking supplements, bring them in. They bring in bags of supplements. I love that. I want to see what they're taking. I love saying, you know what, this is crap, don't take this. Or, geez, Mrs. Jones, you have 3 bottles of the same stuff. You can cut out 2 out of the 3. Have them bring it in, read it, at least look at it. Unfortunately, a lot of us aren't doing that. Reports are showing that 40% of dietary supplement users don't tell this. 70% of these people say our docs didn't ask us. Again, that doesn't mean it's 70%, but there's a significant percentage of physicians who don't. So don't be that woman, don't be that guy. Ask your patients, what supplements you're using, what supplements you take. Popular supplements. There's just a few more than 4. As one can see, if you go into Myers, Walmart, Target, or a health food store, right, where you have literally thousands of supplements. So, you know, I used to pride myself on knowing most of them, and I still know a lot, but there's so many now that, again, you can't keep track of it. However, if you look at studies by health food industry groups and other groups that track what patients are taking, what patients are buying, these 4 are generally always on the top of the list. A multivitamin, multi-mineral complex, vitamin D, glucosamine, chondroitin, and fish oil, especially among the geriatric population. So for the rest of this talk, for what little time I have, we'll look over these, look over some studies. Do they work? Do they not work? What's worthwhile? What's not worthwhile? So I hear this all the time. I hear this from patients, some patients. I hear this a lot from some colleagues. You know what? I don't have my patients take supplements. Why should I? It's worthless. We get all the nutrition we need from our diet. We've seen that over and over again. We have a Western diet. We have a great diet. People get too much supplementation and nutrition, right? Look at all the obesity in this country. That's true. Obesity is a big problem. What's another big problem is that we don't get the nutrition we need. The reality is that 6% of adults meet the food group requirements of 5 servings of fruit a day and 5 servings of vegetables a day. How many in here, honestly, eat at least 5 fruits a day and 5 vegetables a day, every single day? I'm not raising my hand, and I preach this stuff. Right? I'm as big a hypocrite as anybody else. I meet that maybe 3 to 4 days a week. I don't meet it 7 days a week. Our patients don't, I guarantee it. I love this last little blurb. Potatoes, iceberg lettuce, and ketchup account for 50% of our vegetable intake. You know, I got nothing against potatoes, iceberg lettuce, and ketchup. Hell, I probably eat them a few times a week. You're not getting much nutrition from those things. You're really not. So, since we're not eating what we're supposed to eat, since we're eating the standard American diet, or SAD diet, we're not meeting the recommended daily allowances of most vitamins and minerals. This is a busy slide, a little too busy for me, but it's worth looking at in that it's showing us percentage of U.S. population not meeting the RDA of these vitamins and minerals that we'll see in a multi-mineral, multivitamin complex. Everything from around 20% to vitamin B12 to 60% for magnesium and calcium, essential minerals, right? A study just came out last week, I didn't get a chance to put it in here, showing the importance of magnesium for heart health. So, and yet 60% of the population isn't getting just the RDA of that. So, again, people will argue, still, we don't need to take a multivitamin because you don't see deficiencies, right? When was the last time anybody in here saw scurvy? I've seen scurvy when I've done some third world work. I've never seen it in the U.S. You don't see vitamin deficiencies in the U.S. However, if you take into account the poor nutritional value of our standard American diet, then taking a multivitamin might be a reasonable choice. Any studies that back this up? Some not. 2002, JAM editorial, Harvard researchers stated they thought probably prudent for all adults to take a multivitamin, multi-mineral supplement. A recent article in JAMA, well, not too recent, November 14, 2012, out of the Physicians' Health Study, which we're all probably pretty aware of. That was a randomized, double-blind, placebo-controlled trial study of around 14,000 male physicians, not female, unfortunately. That a daily multivitamin supplementation had a statistically reduced risk of, had a statistically significant effect in reducing the risk of total cancer. The 2014 report in ophthalmology out of that same study showed that those male physicians taking a multivitamin had a decreased risk of developing cataracts. Again, other studies will come out and say multivitamins are worthless. The bottom line for me is that, again, unless you're one of those very smart people, very dedicated people that are eating a very good diet, it's probably a reasonable thing to do. Take a multivitamin, multi-mineral every day.
Wait a minute, it says they have a statistically significant risk of developing cataracts. That would be negative.
Statistically significant decreased risk. I forgot to put the decreased risk in there. Yes, I worded it wrong. My mistake. My mistake. Thanks for catching that. Yeah, that would be bad. Vitamin D. We hear a lot about vitamin D. We don't see a lot of it in this state because we don't see Mr. Sunshine much in this state. But some states do. Multiple studies, laboratory studies, observational studies, secondary prevention trials show us that vitamin D can prevent many chronic diseases. And in fact, right now there's a very good, hopefully very good, randomized double-blind placebo-controlled trial called the VITAL trial going on with vitamin D and fish oil, 2,000 international units of vitamin D3 and 1,000 milligrams daily of omega-3 from fish oil in the primary prevention of cancer and cardiovascular disease among 20,000 men and women aged 50 or greater. Studies going on right now. We should start seeing results in the next year or two. No studies yet. But again, hopefully we're going to get some good answers from this. But since that's not here yet, what do we have? Well, we do have some good studies, reasonable studies on vitamin D and heart disease. 2010 article in the American Journal of Cardiology looked at the prevalence of vitamin D deficiency and that deficiency in relationship to cardiovascular disease in a prospective study of around 41,000 patients. Vitamin D deficiency, defined by them as less than 30 nanograms per milliliter, was significantly associated in the prevalence of hypertension, peripheral vascular disease, diabetes, MIs, hyperlipidemia, CAD, heart failure, and stroke. A little more recent article, 2012 article in the same journal, looked at an observational retrospective study on around 11,000 patients, men and women, again looking at vitamin D levels and cardiovascular health. So mean serum vitamin D levels at 24.1 nanograms per mil was associated again with multiple instances of heart disease. Vitamin D supplementation of around 2,000, 2,200 international units a day improved overall survival. The RDA of vitamin D is 800 international units, so significantly above the RDA. I thought it was worth quoting the authors of that study here, stating vitamin D deficiency was associated with a significantly decreased risk of, I must have had a brain fart in terms of using that word decreased risk. Decreased risk of cardiovascular disease and reduced survival. Vitamin D supplementation was significantly associated with better survival, specifically in patients with documented deficiency. Again, documented deficiency by them being less than 25 nanograms per mil. What about diabetes? Well, we have some data from the EPIC study out of Europe showing a definitive inverse association between vitamin D levels and risk of developing type 2 diabetes. A little more recent study, 2013, looked at around 2,000 Chinese men and women, those in the lowest quartile again, less than 20 nanograms per mil, had a statistically significant risk of developing insulin resistance and type 2 diabetes, and those with vitamin D serum levels of 30 nanograms per mil or above. What about cancer? Vitamin D is proposed to act as an anti-cancer molecule by having multiple anti-cancer effects, anti-proliferative, pro-apoptotic, pro-differentiating actions. Recent article out last year, the American Journal of Clinical Nutrition, looked at the role of vitamin D in lung cancer. Examination of data from around 130,000 women, so that supplemental vitamin D intake, even at the low level, in my opinion, and many people's opinion, of 800 international units a day, associated lower lung cancer risk. A meta-analysis of 10 studies of around 7,000 male and female patients looked at vitamin D and colon cancer risk. Again, a strong inverse relationship. Higher levels of vitamin D, lower levels of colon cancer. Breast cancer study out of Australia, 2013. Case control study, 214 women, 852 controls, 55 plus or minus years. Those women with vitamin D level of less than 75 nanomoles per liter had a statistically higher risk of developing breast cancer. So, again, the bottom line, report out of Boston University School of Medicine, again, worth reading. Quote unquote, a multitude of studies have associated improved vitamin D status with decreased risk, finally got the word right, decreased risk of developing several cancers, including colon, breast, pancreatic, ovarian. The goal of supplementation is to achieve blood levels of 25-hydroxy vitamin D of 40 to 60 nanograms per mil. In my clinical opinion and other people's work and other studies, to achieve levels of 40 to 60 nanograms per mil, you will need to take at least 3,000 to 4,000 international units of vitamin D a day. Give myself an example. In the wintertime, I take 5,000 international units of vitamin D a day. My level in March was 55. So taking 800 international units of vitamin D a day is above a homeopathic dose, but not far above it, in my opinion. In this state, I advise everybody, all my patients, unless contraindicated, of course, to take at least 2,000 international units a day. Many of my patients I have on 4,000 to 5,000 a day. In the wintertime, maybe more. If they're out a lot in the summertime, I'm fortunate that I have some land and I'm outside a lot in the summer. I back off to 1,000 to 2,000 a day. You cannot have acute toxicity from vitamin D. You can have long-term, but you cannot acutely kill yourself in vitamin D, as you can with vitamin A. Not that I'm giving anybody ideas to commit suicide, but you can't do it with vitamin D. You can eat a bucket full of vitamin D a day. After about 4 or 5 months, you might off yourself, but it would take a long time. So it's very safe. Another one, supplement that's used a lot by geriatric patients and other patients with arthritic conditions, glucosamine and chondroitin. Why is that? Well, it's proposed that it helps not only with pain, but it helps decrease the risk, and some people say it helps reverse arthritis. Well, what do studies show us? Well, a little older study, 2007 randomized double-blind placebo-controlled study of 318 men and women, showed that glucosamine was statistically more effective than placebo or acetaminophen in treating osteoarthritic knee symptoms, including pain and mobility. A little more, one that's recent, a 2009 review showed that glucosamine or glucosamine and chondroitin statistically reduced the risk of OA knee progression. So it actually slowed the progression of the disease process down, which is pretty neat. A recent study that just came out in the Annals of Rheumatic Diseases discussed a double-blind, placebo-controlled randomized trial with glucosamine and chondroitin for knee osteoarthritis. 605 patients, 45 to 75 years, received either glucosamine, chondroitin, or placebo. After 2 years, those taking GC showed a statistically significant reduction in joint space reduction as compared to placebo. So again, slowing down the rate of disease progression, which is pretty amazing if you think about it. No significant adverse side effects. Dosage of 1,000 to 1,500 milligrams a day. Study after study shows us that anything above 1,500 milligrams really isn't going to do you any more good than 1,500 milligrams. So 1,000 to 1,500. Again, this is America. In America, we like to think the bigger the better, the more the better. If 1,500 is good, 3,000 is better. If 3,000 is better, hell, 5,000 is great. Well, it's not going to hurt you. It's just going to waste your money, and I hate to see patients wasting money. So 1,000 to 1,500 a day. I've never seen it. I've heard some anecdotal reports, but I don't see it in my patients with diabetes. Certainly want to watch it, but. Fish oil, another supplement that I pretty much recommend to everybody. We require 2 types, we human beings, Homo sapiens, require 2 types of essential fatty acids, omega-6 and omega-3s. We don't get these, we eventually die. Omega-6s come from plants, sunflower, corn, soybean oils. The stuff we use in our agriculture, the stuff we use in our processed foods, the stuff we feed our animals. Omega-3 sources include fish, flaxseed, nuts, and canola oil. The ideal ratio is thought to be around 2 to 1. For every 2 parts of omega-6, 1 part of omega-3. Some people say 1 to 1, others 2 to 1, but it's right around there, 2 to 1 or 1 to 1. Current ratio that we get in our standard American diet is around 20 to 1. Why is that? Well, it's the way we make our foods. It's the way we use vegetable oils and processed foods. It's the way we feed our foodstuffs, our production line, our factory animals, what I call it, right? The hamburger we buy at the store that comes from huge cattle factories out in Nebraska. If you've ever been out west, you've seen these things where there's thousands upon thousands of animals. It's a factory. So it's around 10 or 20 to 1. A multitude of clinical applications for omega-3. Again, everybody knows it about pregnancy. Certainly everybody should know about it, right? And all my pregnant patients, all my female patients that are trying to get pregnant, they need to be taking omega-3 fatty acids. You need to be taking fish oil or some type of supplement with omega-3s, even before they get pregnant. So once they get pregnant, it's already in their body. It's extremely important. My children have been taking it before they were born. They're now 16 and 14 and continue to take it. My daughter begrudgingly, my son less so, but they still take it. At least when they're with me. 2012 article in the Journal of Nutrition showed strong evidence that omega-3 fatty acids can help prevent fatal coronary heart disease, sudden death, AFib, and congestive heart failure. A 2013 double-blind randomized placebo-controlled study for mild cognitive impairment showed those patients, male, female, greater than age 59, taking fish oil supplements had statistically significant improvements, short-term and working memory, immediate verbal memory, and delayed recall ability. don't know about you, but I had many calls about this, and many patients asking me about this, because it was in the news all over last year, right? Fish oil causes prostate cancer. Well, it came from this study by Bradsky in the Journal of the National Cancer Institute, reporting that omega-3 fatty acids are involved in prostate cancer in occurrence. Again, blown up by the media. You couldn't throw a stick. You couldn't turn on a web browser without seeing a headline like this. Hold the salmon. Omega-3 fatty acids linked to higher risk of cancer. Anybody have any idea where, this is a true headline, where that was from? Even better, Time magazine. I would trust The Onion more than I would trust Time. At least they have a good sense of humor. Oh yeah, it's all over, right? Don't eat salmon because it's going to give you prostate cancer. Well, how many in here read the Bradsky article? Really read it? Right, good, excellent. So, for those who didn't read it, here's what it showed. It measured plasma phospholipid omega-3 levels in 834 men who developed prostate cancer, and then around 1,400 who didn't. Men who had the highest levels of omega-3 fatty acids had an increased risk of 43%. The difference was extraordinarily small, 0.18%, 4.48. And those who didn't, 4.66 who did. Extremely small. Again, I'm not a scientist, I'm just a country doctor at Michigan State, but to me that's kind of small. What I found interesting was that the study provided no data on fish intake or omega-3 supplement use. None. So all these headlines saying, oh, you know, don't eat your fish, don't take supplements. How can you say that? This study didn't look at that. The study looked at levels. It didn't look at anything. It didn't look at supplementation. It didn't even look at eating fish. So the hyperbole that came out from this study was not amazing, but was discouraging. I'd use other words, but I'm being taped, so I won't. The fact of the matter is there's multiple studies showing us the protective effects of omega-3 fatty acids in terms of prostate cancer. 2003 article in the American Journal of Epidemiology looked at the association between omega-3 fatty acids, fish oil, and the risk of developing prostate cancer. And these authors came to the conclusion that omega-3 fatty acids and fish oil were inversely associated with prostate cancer occurrence. So, again, to say that omega-3 fatty acids cause prostate cancer, to tell your patients, no, don't eat fatty fish, don't take omega-3 supplements, I think is way, way too early to say. I'm still encouraging my patients to take omega-3 supplements, to eat fish. I'm still taking fish oil, so until some more definitive data comes out, I think we all should be taking it. So the bottom line is that whether we like it or not, our patients, especially our geriatric patients, are taking supplements, are using complementary and alternative medicine. So we in the osteopathic community, in my opinion, must continue to push for what works, what doesn't work, so we can give our patients the best advice that we can. I mean, really, that's what it's about. They come to us for advice. The onus is on us to know what we're talking about, and if we don't know what we're talking about, tell our patients, hey, we'll look it up and let you know. That's it. Any questions? Yes?
There are certain facts that you come across that are helpful as far as questions?
Looking at what questions?
Like if they have questions about specific supplements or a condition, is there a fact that you have come up?
Not particularly. Again, there's a multitude of blood tests one can run, but not one.
You know specific like textbook or reference?
There's multiple textbook references that are out there. Yes?
Well, actually, the German government, the Department of Health, whatever, I don't know here, but my brother knows locally, they run a bunch of, studies on, what is the thing, people do, I think it's a plant, echinacea.
Echinacea. Yeah, certainly, yeah.
I read government studies, I'm not, frankly, I'm not interested, but I know that the government of Germany is very interested in these types of questions.
Absolutely, because in Germany and the European countries, the use of herbal medications is codified, just like it is pharmaceutically here. In terms of herbal medicine, the answer to the previous question was the American Botanical Council. That's if you want to look at any type of herbal medicine, they're here in the States. They do a great job. They put out a quarterly magazine, and I think they're probably the most impartial and most scientifically based. Other questions? Yes.
You didn't mention anything about vitamin E, which also has become popular.
I didn't.
Which also has been controversial. Why isn't it here?
And I didn't mention it, again, because I just ran out of time. Certainly, again, so when we talk about vitamin E, again, another thing that people throw that word out there, what is vitamin E? There is no vitamin E. There's 4 tocotrienols, 4 tocopherols. When we eat avocado, when we eat certain substances, God didn't put 400 international units of synthetic vitamin alpha tocopherol in there, right? If you're going to take a vitamin E supplement, you need to take one with all the tocopherols and all the tocotrienols. That's what I tell my patients. I mean, natural. I don't care if it's natural or synthetic, but it needs to be all the substances that make up vitamin E, because there's not just vitamin E. There's multiple chemicals in it. Good question, though. Yes.
Do you prefer vitamin D supplement that you encourage patients to take?
Brand? A brand?
Specific, yeah, you know, D2, D3.
Oh, me personally, I take a Rite Aid vitamin D3 because I can get 2 for 1 bottles. So I'm serious about that. So yeah, it cost me about $5 a month, so it's great. Yeah. So everybody, yeah, one more question, then I'll let you guys get out.
If a patient's allergic to the fish, would they be allergic to the fish oil?
Don't know, and I don't want to find out. So I'll tell them to take, seriously, I'll tell them to take flaxseed oil. There's other ways to get omega-3s. You can get it from flaxseed, get it from krill oil. There's other ways. I mean, if you look like a pretty brave guy, you can try and let me know. Again, I know everybody's hungry. I'm happy to stay here for as long as anybody wants. I love talking about this stuff. So have a great night. Enjoy your evening. Thank you.